first one, which is on mature intumescent cataracts. So there would be three speakers, Dr. DEEPAK MEGUR, Dr. Subhash, and Rohit. So Dr. DEEPAK MEGUR, would you get?
Sir, my opponent in debate is also the moderator. We need to have an...
3 minutes. 3 minutes. 3 minutes. Yeah.
Good morning, friends. And I'll be speaking on the manual way of doing rexes in intumescent cataracts. And these are my two opponents here in the debate. And both of them are my seniors. And they're one of the finest surgeons in our country. And I have immense respect for them. I learned from them a lot. And the biggest joke or the irony is that these are the only people who don't require any of these fancy tools, and they're going to talk on how to use them in intumescent cataracts. My sympathies to you, both of you, sir, and because you can't justify the justifiable. अरे बच्चा जानता है, every new kid world over knows that, you know, the only way or the safest way to do is the two-stage rexes, which is a gold standard. And it is given reproducible results in an average surgeon and new kid also. What we require is a soft eye, and you have to use good viscoelastics, and we have got a lot of economical Indian variants as well. And you need to have some fine forceps. Dr. Haldipurkar's forceps is the one which is my favorite. Of course, you can have the micro forceps and scissors of your choice. They give excellent control, maintain the chamber, you decompress the bag after creating the primary rexes, and then the job is done. It's a child's play. And you have a perfectly well-centered, appropriately sized rexes. This is an anterior-chamber depth is 1.73 millimeter in a phacomorphic glaucoma. I'm not sure you can place that Zepto device inside so safely. Again, the trick here to get the primary small rexes right, and apart from using a heavy OVD, if you use a tearing technique where the flap is kept flat and pulled centripetally, you can get the rexes perfectly well. And of course, then decompression is your choice. You can use a wide bore cannula, bimanual IA system, whatever you do. And once the bag is decompressed, the secondary enlargement is perfectly fine. You get a perfectly well-centered rexes in, I'm sure most of you have done tens of thousands of cases, including multifocals, torics, and premium cataract surgery can be done with just these technique itself. You don't require to have this fancy Femto, Zepto for premium cataract surgery. What you require is a premium surgeon for premium cataract surgery, not these devices. And of course, there's numerous statistical analysis which are available which substantiate my this thing. And this is a wonderful 3 crore machine which can also successfully inducing radial extension in these intumescent cataracts as well. So the current state of affairs, the sad state is we market them as robotic. We have a Bade Mia and the Chote Mia, Zepto as well. And where are we heading, actually? Frankly, a lot of introspection is required here. It's nothing but an expensive, silly device to cut the capsule, which is marketed as robotic surgery. Where is the robots here? I just can't understand. And when we come back, why we do is some basic human desire. We want to differentiate ourselves from the crowd. We want to prove that we are better. But sadly, to tell me that, you know, in the current stage of evolution of these devices, being not only they're expensive, but they're nothing less than a gimmick. I'm sure most of the surgeons world over have realized that. You can just check the sales figures of each of them and you come to know. I would conclude by saying that rexes is one of the only remaining art in our Phaco surgery which is dependent on our skills. Rest of all, Phaco, everything is mechanized. And there's no greater joy in doing these surgery. And you take away this, and there's nothing fun in doing surgeries. That's it. Thank you, sir.